Hey guys, Advanced Sports here again. All right, we're going to go over some just mechanics for squatting. So we get a lot of questions on this about position of the feet, knees, and how you should be positioned in reference to your knees. So at Advanced Sports, we always think functionally. As our athletes do, as we function in life. Sitting in a chair, getting up from a couch, those type of things. So these are the little tips that we usually will tell patients, okay, when we're teaching in the proper form. So one thing is feet have to be about shoulder width apart and straight. So a lot of times people are turning their feet out, or when you squat, many times the feet start to turn out, and that's typically because of tight calves. So if you have to compensate and turn your feet out, I say stretch your calves out. Gastroc and soleus stretching. Ask your therapist, start doing those so you're not compensating for it. All right, so feet straight, about shoulder width apart. All right, when you squat down, the other thing that we see a lot is knees dropping in, and that's due to weak hip muscles, okay? And that's what we're preventing when we're teaching the athletes, so we're not tearing up our ligaments in our knees, okay? So I usually give the cue of knees over pinky toes, all right? So that we're not drifting in at all inside the feet, and we're keeping our kneecaps over our pinky toes, okay? And depending on what sport they're doing, we're working on different levels of squatting, but this is a pretty good position here, all right, as far as from the front. This is what we're looking at. All right, then from the side, what we usually will look at is a lot of people are taught to squat and stick their butt out and not get their knees over their toes. Well, that's not something that we do functionally. When we're squatting down to the floor, your knees have to come forward of your toes. Also, we try to keep our center of gravity in front of our knees as well. All right, so from the side, what I'm looking at is making sure that people are hinging at their hips and getting their shoulders in front of their knees, all right? And their knees, not that I'm telling the patient to push their knees in front of their toes, but naturally will happen. I'm just not telling them to prevent it from happening, okay? So that's pretty good position from the side. Okay, just like that. All right, that's a squat. Now, as far as the lunge is concerned, same principles. Okay, so from the front, foot straight, knee is going to stay over their pinky toe, so they're not drifting in. And then I want their center of gravity over their knee. So same type of position where I want your shoulders in front of your knee. And this is essential especially for athletes, because we're thinking of running in a sport and making a cut, right? So if I'm going to show you from the side, a lot of times, again, I see people doing lunges this way, okay, where their center of gravity is equal between the front foot and the rear foot. But in real life, in sports, we don't work that way, especially when we're running and cutting, okay? So we want to teach our athletes to get their center of gravity over that front foot. Again, staying with the same principles that we taught in the squat, with the foot straight, knee over the pinky toe, but center of gravity has to be over that knee, all right? So that they can step and take a cut and make that cut quick. If their center of gravity is too far back, what has to happen? They have to get their whole center of gravity forward of that front knee to make that cut anyway. So why are we teaching our patients or anybody to do a lunge like this? It's just not functional. Why not teach them the proper way so that they can function better in life and protect themselves? All right? So that was all my little thing on squats and lunges today. Send in requests, and we'll go over some other exercises or activities that you're concerned about. All right? Have a great day.